Hi folks, Kevin here. Well, it's February 9th, 2018, and today I'm uploading this video in hopes of accomplishing two things. One is a general bit of information on how to approach use an application online or on your phone, and that's epocrates. And when I get done with this intro video part, I'll go in and see if I can bring it up on my computer and talk over it and see if this all makes sense. But the other thing I'm doing is trying to reach out to one of my clients who, former clients, who messaged me through Facebook today. Now I typically don't use Facebook. I just have two friends, my wife and my son, on Facebook right now. And that's to make things a little less distracting for me to get all the things I need to get done here in life. The main media that I want to use for communicating with people is the YouTube channel. That's why I'm posting it here. But I thought with the questions and the situation that Brandon has encountered, potentially other people can benefit from this information. Because what I want to do is take you next to that online application. So first, my condolences for the recent loss of your dog, Brandon. And now Brandon's new dog tore a anterior cruciate ligament, a common knee injury, and many people are familiar with this as well. Some of their friends and family have had ruptured cruciate ligaments. It's not an uncommon injury for very, very active sports folks or for those who are having some collagen cartilage issues as well, and they can be diet related. So, and this is, the question is about, I guess, two questions here. What about medications and confidence in your professional? So, first off, there was an injury to the knee. Brandon took Atlas to his regular veterinarian, and they prescribed two commonly prescribed medications, Tramadol and Medicam. The human, if you're to look up Medicam, you could Google it and you'd see that the human name for it is meloxicam. In veterinary medicine, we change names to be very special, I guess, probably part of the marketing approaches. So those two medications together, your vet was right, it's in the standard of care. They're very good at bringing down the patient's level of discomfort below that high level of the pain threshold. So the combination acts synergistically because there are two different mechanisms of action that really decrease the amount of discomfort that a patient will feel. So that was right. But shortly after starting on the Medicam, Atlas began to vomit and stopped eating, and the vomit contained water at that time. So when we get into a situation like that, well, what do we do? What Brandon did, he went back to the vet's office, and the vet prescribed a few different medications. One is sucralfate, omeprazole, and ondansetron. So all three of those medications are also very appropriate. Your vet did everything right in that respect, so it would meet with my approval. It's not necessarily the way what I would do in the whole realm of things, but that's absolutely a good protocol because I'm more diet related now as I've educated myself more about nutrition. But anyways, now there's spots of blood. It isn't gushing blood, but I'm assuming it's small spots of little blood clots or speckles of blood. And Brandon is concerned that this has gone from a simple injury to a life-threatening situation. So this is the first point that I want to make before I get to the drugs. One thing I learned years ago practicing as an emergency clinician at a university hospital was an actual emergency case is actually an emergency that it could be bleeding, being hit by a car, all the tremendous list of things that clinicians say, yeah, that's definitely an emergency. The patient swallowed poison, was hit by a snowplow, whatever it is. The other group of emergency situations is if the client believes that it's an emergency situation. If your gut tells you that there's something wrong here, listen to your gut. You know, it's something that's really important. Yes, it'll cost you money going to see an emergency clinician, but I think it's really important to do a gut check and realize that this is something to deal with. Now, the other point is, yes, after hours going to emergency clinics, and you know, it can be extremely expensive, and sometimes not. The clinicians may not select the most specific testing modalities that are most cost effective but still yield an appropriate amount of information. I'm not trying to dance around things, but sometimes it can really run up a bill if the clinician isn't really mindful of your specific circumstances and be very selective. What test will help us the most? But anyways, a good physical exam and a history and knowing these medications is really important. So the first point that I really want to make is what I've just alluded to is you need to trust yourself. All of us need to have that type of relationship. The second point is if you feel that your professional, whether it's your medical doctor, your surgeon, your veterinarian, your lawyer, if you feel that you're being dismissed, then it's time for you to interview someone else. And so those of you who've had experiences with feeling uncomfortable, feeling like recently I read an email from a person who said he just felt like, you know, the doctors really weren't listening to him. He felt like he was being treated like a herd of cattle, just being pushed through the system. And I'm sensitive to that feeling, feeling that they aren't helping to coach you through the process, investing in you. And to speak from the clinician side, they've got so much time, so little time on their hands to deal with what needs to be done. And quite honestly, that FaceTime that you have with them and the lab work that they do, all of that's part of it, but there's a big part behind that they have to do with each case as well. But really owning your responsibility of you selecting the person, the expert that you're working with. And something that I always recommend is going and spending the initial exam fee to go and interview them before there's ever a problem. Find out if you're comfortable with them. Do a gut check. So, if you're anal retentive like me, have a list of questions about, well, how important do you think diet is as far as healthcare? You know, interview the person, the professional that's giving you advice, and that goes with all aspects of life. Whether it's your financial advisor, whether it's your attorney, whatever. Make sure you're both working together because you're paying them for their expertise. So, but I want you to know that what your vet, Brandon, I just want you to know that what your vet recommended throughout the process was absolutely right. So I hope that helps out some. But if you still feel uncomfortable, I'm going to post this video as soon as I record the next part. But the next part of this video, I'm going to take you and bring up online epocrates. And we're going to go to that right now. And let's see how that goes. Okay, I'm at the computer now, and I've gone ahead and opened up Chrome for me, Google Chrome. And the website we're going to is epocrates. And so the web address to type in is online.epocrates.com. So online.epocrates.com. So that's the website to go to. So I've just made the screen a bit bigger here for me. So this is both a paid prescription, a paid service, and a free service. So I think you can use both drugs and interactions for free. I don't know of all the other, I don't use it all that often, but I use it for these two. So if you wanted to say, and it's broken down by categories, you can check for things by alphabetical list and all. So let's just put in aspirin. And you can see that we've got aspirin here, and you can select the different types of aspirin, but it comes into adult dosing. You can go to pediatric dosing, so you can know what the appropriate dose is for children. Whoop. This is an adult dose, so it's more than the 80 milligrams. And you can see what the drug adverse reactions are, whether we're going to have GI bleeding at all, because it's a non-steroidal anti-inflammatory drug. And you can see what the pill pictures look like. And I guess this isn't going to, oh, I hit another button. Safety monitoring, so if you're pregnant or lactating, all of that. So that's under drugs and all, and I think that's a very valuable tool. We all need to understand what medications we're taking and all. So now I'm going to come over here to interactions. I click on interactions, and that's when we have two drugs or supplements that you're taking at home to see, is there a potential adverse effect associated with the combination of medications, which is really important. So let's put tramadol in. So I just start typing it, and you can see here are the other trade names for it. You know, I'm just going down to the generic tramadol, and that's added over here in the selected drugs. It's going to do, as we add more drugs in this column in the selected drugs, it's going to tell us, ooh, there's a possible interaction between these drugs. So let's put another drug in here. So it was Metacam, which is meloxicam. And you can see down here there's a few different names, so I'm just going to click on meloxicam. And so far, Metacam and tramadol, they work together synergistically, and their synergism doesn't really have an interference. So in other words, tramadol doesn't amplify meloxicam's effect or attenuate its effect. So then the next couple of drugs, so there was carafate, which is sucralfate. So there we have carafate. We say, okay, so far all three of these drugs seem to be pretty darn good. Then we got omeprazole. And you can see I'll just select omeprazole. And you can see, well, there is a potential interaction. So omeprazole, omeprazole here is a proton pump inhibitor. So here's something, the combination, the sucralfate, which binds to other medications, it binds to the gastric epithelium, the lining of the cell, and it stimulates healing of the epithelial cells. So that carafate or sucralfate is really beneficial for healing ulcerative or excoriated surfaces of those tissues. And it's got to be put into a solution form. So typically I would say, if the patient's vomiting some, one of the things I do is, we put it in a syringe, the big tablet in a syringe, and make it like it looks like milk of magnesia, but that's a totally different medication. So the calfrate, when it's put into a liquid form and they swallow it and they get it in their tummy, well, then that tends to coat the surface of the gastric mucosa and stimulates healing. Well, it also, since it binds so well to that, it could, if it was given at the same time as the omeprazole, it could decrease the efficacy of the omeprazole. Therefore, they're recommending giving the omeprazole 30 minutes before giving the carafate. Now, omeprazole is a proton pump inhibitor, and I'll be talking about that as far as the microbes in our digestive system in the future, and why I think that that's not the best medication to be using by and large and in general. But once again, I want to repeat, your veterinarian prescribed appropriate medications. So I just want you to know that. Now let's look. We got another medication, ondansetron. So we do have another potential reaction here. Down here, it's saying that the tramadol and ondansetron, the combination may risk arrhythmias, heart arrhythmias. So that's something that I always like to teach my clients when there's a combination of medications, is how to check the pulses in the hind limbs, or listen to the heart or feel the heart, depending on how heavy the patient is. So that's one thing you can do, is have your veterinarian or your doctor teach you how to check your own pulse. So if you're on these medications, and that's one of the things that I would say is always important, is informed consent. Making sure, okay, we're taking these medications, please tell me all the things that I need to know. Now, nowadays you go to the pharmacy and they give you this big printout with fine print, or your doctor's office may do the same thing. I think it's important to actually discuss these things as well. So that takes care of all the medications. But let's just say you're one of those conscientious people that says, you know what, I've read about omega-3 fatty acids. I think those are really good. So let's put in, so I'm putting down omega-3 fatty esters. So now we got meloxicam, which is Metacam, and omega-3 fatty acids. The combination may increase the risk of bleeding because it interferes with platelets. And if there's a disorder associated with platelets, that could be something. So that's just one more thing. It's always advisable to have a complete list of whatever medications you, your loved ones, your children, your wife, they need to have a copy of this stuff in their wallet as well, and your pets. So we know all of the things, the supplements that you're giving. Now, some people would say, you know what, I've heard that baby doses of aspirin. So let me see, baby aspirin. Okay, 1 second. Aspirin. I'm just trying to see the baby dose. Oh, low dose St. John's. All right. So if we're to add that to the list, and your vet didn't realize that you were also giving that, well, now we have 3 different potential reactions. We have, aspirin being given, even though it's a tiny dose, that would be appropriate for, that many people would think is potentially protective and all. But if meloxicam, the baby aspirin were used, and the omega-3 fatty acids were all used together, well, that's a pretty significant concern. So those are things to think about. And there are so many things that are in our diets as far as additives as well. But I think I'll end this video here, or at least stop going through epocrates right now. So it is https://online.epocrates.com. So that's the website. And the things that I think there's, besides using Epocrates as a resource, I think that this is a time where we increase our resilience, we decrease our outside dependence by how we foster relationships with professionals, people that we're actually paying. So historically, the doctor-patient relationship involved, the patient being completely dependent on the professional, and that the professional was the authority, and people transferred the responsibility to that professional. And I think it's time for a rather improved relationship with professionals, and I'm using veterinarian or doctor patient relationship right now, or veterinarian client relationship. I think of it as being more beneficial if we have partnerships where we're goal-oriented and effective communication is being used. This can be very challenging because we're trying to change the paradigm of this relationship, and professionals have limited time, and people, if they aren't really prepared ahead of time, and that's why I say it's so important for us to own the responsibility of being prepared before we consult with them, being prepared with a list of the medications in emergent situations. So you never know when there's going to be a car accident or some other unforeseen event. And having a list of what your normal diet is, prior medical problems that have been addressed, what treatments have been done in the past, all nutraceuticals or vitamins and supplements that you're on, or specialty diets. Certainly, a whole variety of things are very, very important that a professional will want to take into account when they're assessing the health status of a patient. So you being prepared ahead of time is really important. And I know Brandon was. This is just some general statements that I want to make. And have it being goal oriented so that your professional knows. I've had people come to me before and say, well, you're the expert, you do whatever you think is best, and those weren't people that I wanted to work with. I'd much rather have it where we're discussing openly and honestly, well, there's benefits if we do this, and there's drawbacks if we do this. And there's times where I didn't do further testing because if a test result wouldn't change what I was ultimately going to recommend next, then we didn't do that test. So I won't go any further with this whole thing. I just think it's so important to honor the relationship that we have with our professionals. And the best way we can honor it is by honoring ourselves and owning our own responsibilities. So if you think this was helpful, please give it a thumbs up and share it with your friends. Feel free to leave comments and ask questions. I think that helps with the community. I know that this channel is kind of odd because I'm talking about these permaculture topics and hulu culture and growing food and nutrition and making smoothies and whole food plant-based, and now I'm going into this whole lifestyle medicine topic. And I know I've lost quite a few subscribers, but I've also gained some subscribers recently as well. So by letting me know what you think with thumbs up or your comments gives me feedback to know where to go next and all. Well, once again, I thank you so much for your time, and please have a fantastic day. Bye-bye now.